So I'm refuting Geneva Elizondo's claim of fact that medical marijuana is a positive medical benefit for treating a variety of patients suffering with different kinds of pain. So her 3 points that I will be refuting, her 3 secondary claims that I will be refuting is first, medical marijuana encourages a positive effect on alleviating anxiety symptoms. 2, that cannabinoid usage has a profound effect on relieving pain from cancer patients. And 3, that experience among young patients using cannabinoid to treat their epilepsy shows that medical marijuana is a positive benefit to children in society. In this speech, I'll show how this argument is weak based on the fact that the evidence she used is based on insufficient research. Her first supporting claim that medical marijuana encourages a positive effect on alleviating anxiety symptoms. According to Timothy Welty, Chair of Department of Clinical Sciences at Drake University's College of Pharmacy and Health Sciences, wild cannabidiol, which is an extract found in marijuana, is believed to be able to treat many medical problems. The only purported use for it is to treat epilepsy, so not anxiety. And while it is true that some human clinical trials have suggested that cannabidiol could be effective in treating anxiety, there is not enough evidence according to WebMD. Geneva also brought up how cannabidiol is beneficial as it is a more natural form of treatment for patients with anxiety. However, marijuana being natural rather than synthetic does not make it any more or less helpful in treatment. Her second supporting claim was that cannabinoid usage has a profound effect on relieving pain from cancer patients. And according to one section of the Newsweek article by Jessica Ferber that Geneva cited, there has been enough research to prove that at a bare minimum, cannabis won't actually harm a person. While it is a good thing if the medical marijuana will not harm anyone, her main claim was not that it had no harms, but that it is a benefit. And so that doesn't support her claim. Also, it is not necessarily true that there is enough research conducted to prove that there are no risks with cannabis. According to National Academy of Medicine, while it is true that there are no proven harms in taking cannabis, there are many uncertain potential risks with it. With both the potential benefits and the potential harms, there is not enough research to prove either way with certainty, and there needs to be more research conducted before making such a claim. Her third supporting point was that experience amongst young patients using cannabinoid to treat their epilepsy shows that medical marijuana is a positive benefit to children in society. The research she used to solidify the second claim that cannabidiol-enriched cannabis is effective in treating children is from a Facebook group of parents who have children that suffer with epilepsy. While the results of the survey may be accurate, a Facebook survey is not a credible or strong enough source to be used for solidifying the claim. There are no clinical trials that can back up the claim that medical marijuana is safe for anyone, including children, and according to FDA, that is the reason why they don't approve the drug for medical use. While the FDA is sympathetic to the fact that parents want to give their children the best medicine for the best results, and that's why they might want to use marijuana, they strongly advise against it since it's not a clinically tested drug, and instead they encourage that caregivers and patients can be confident in using the FDA-approved drugs that have been carefully evaluated for safety, efficacy, and quality and are monitored by the FDA once they're on the market. The Children's Hospital Colorado also advises against parents giving their children CBD, saying that while there have been many cases that show the potential benefits for it, there have also been very many cases where the treatment has been associated with the worsening of seizures or other serious side effects leading children to be hospitalized. Until medical marijuana is tested to be a safe drug, parents should not administer this drug to their kids. So.
The structural stuff is fine. It's easy to follow. On the anxiety issue, on the first point, you've got press about the sufficiency of proof on this. Basically, the evidence you're suggesting says that it doesn't really, it has its only purported uses for epilepsy, and there's no evidence that shows that, or there's not adequate evidence to show that it deals with anxiety. And the fact that it is not necessarily harmful doesn't show that it doesn't have any medical benefit. I think that was a very reasonable press on that, and if that's what their evidence suggested, then you found their interpretation to be unreasonable, and you explained it pretty well. On the second point, actually, that is the second point that you were making right there. I think you are conceding the notion that there isn't any risk to begin with, because it's not demonstrated risk. You're willing to go along with the evidence that comes from the one source that says we have unqualified risks or unquantifiable risks. Just like we have the same thing with the potential benefits, there are potential harms. If you could inventory those a little bit more, I think that would give people a little bit of hesitation about assuming that this is an appropriate way to proceed in treating either their anxiety or their child's epilepsy. On the epilepsy argument, you're much more specific about this. You challenge the advocate's only evidence, apparently coming from a Facebook post. The absence of clinical trials, I think, is pretty good. Although I'm not sure if you had a source citation on that. The FDA doesn't approve it because of potential risks. I assume that's a piece of factual data. Again, and it's probably the FDA saying that, but there's not a source citation on it. And then the FDA does recommend a variety of drugs that do treat those kinds of things. And I don't remember if the advocates had a comparative set of data for approved drugs versus the cannabinoid oils or marijuana use itself. I think that would be something that would be helpful either for the advocate or for you to have. And then the last point, I think, is probably the best piece of evidence that you had in your argument, and that is that potentially it could have negative effects also. So the notion that it could go either direction, I think, is, look, we don't have a sufficient amount of information. If it can go either direction, you really want to be careful about harming your child when it comes to giving them these home remedies, so to speak. All right, thank you.